Toothache is a pain in your tooth, but of course it can spread to other areas of your mouth, and it can even affect your jawbone and radiate up to areas of your face and to your head, to your ear, and down your neck. So toothache is very painful. The trouble with toothache is that toothaches are not all the same. And it's really important, if you're going to self-medicate, that you understand one toothache is very different from another, and that different toothaches require different therapies. Yes, it's absolutely true that in ancient times, clove oil was used as a remedy for toothache. And I'll explain that it can be very helpful. But there are other alternatives that today we know about that back then maybe they didn't know about, natural alternatives that for most toothaches would be a preferable thing to do. The concentration and the way that you medicate the tooth is very important. And then the third thing is that you need to know most dentists and most doctors are very conflicted. They are not in support of the use of clove oil because they are well aware that, first of all, if you start putting clove oil in your mouth, you may create new symptoms, a different story about your toothache. And that can make it very difficult for your doctor or your dentist to diagnose what's really going on. You see, clove oil has a very active component, and that component is called eugenol. And eugenol is being studied today. We know that it is actually very bioactive. It has very good properties at the right concentration. And the properties that it is antibacterial. That means it gets rid of certain bacteria. It also is anti-inflammatory. It calms things down. It also is analgesic and anesthetic in its sense. It dulls the pain that you might feel. It dulls the nerves sensations. Sounds like a miracle, right, for toothache? But the problem with clove oil, or the eugenol that is in clove oil, is that it can melt into your saliva while you're applying it to your tooth. That's the first thing. And then it will numb your entire mouth. If you swallow it, you can have real difficulty breathing. It is not helpful. And for children, I absolutely believe that clove oil should never, ever be used for children's care. It is in teething gels, and I don't believe that that is something I would ever recommend to anybody that knows me. I would tell them, instead of using clove oil, just get a bag of granular xylitol, dissolve about 1/4 teaspoon of the granular xylitol in water, and wipe that over the baby teeth that are causing any problems. In fact, you should do that as soon as you are aware baby teeth are coming into the mouth, and you can avoid preemptively, before you have a problem, avoid these problems with a regular application of xylitol. Clove oil tastes disgusting. It tastes awful. Taste it for yourself before you even think about putting it in your baby's mouth. And don't put it in your baby's mouth, because we know even at low concentrations, clove oil can create DNA damage in the skin cells. That's not something you want to do to your infant. So do not use clove oil in a child's mouth. If they swallow it, it can make a child extremely ill. They can have seizures. They can have digestive problems. It can cause problems in their nasal passages. If they regurgitate it, it can burn their mouth. So please, there are better ways. And I would recommend, if you're having teething problems or you have a thrush infection, xylitol is the delicious, sweet, beautiful alternative method of creating a happier place in the mouth for these teeth. And xylitol will feed the good bacteria. It's not killing anything. It's just feeding the good bacteria and helping to get rid of inflammation in a far better way. So definitely for children, I do not recommend clove oil ever. But how about for adults? Knowing that clove oil has these sort of anti-inflammatory, antibacterial effects, it sounds like it should be really good. And believe me, as a dentist in the 1970s, I used clove oil. It was one of the things we used to mix up with zinc oxide, which is a powder, white powder, and we mixed it into a paste and used it as a temporary filling. It was a great filling. In a baby tooth that was going to fall out within a year or so, we would put this zinc oxide filling in there, and it calmed any toothache down, and it lasted a year or so. It's a soft filling, so it isn't a permanent filling, but it was a great alternative, quick and easy to put on, and it stopped any decay that was happening. So it was a really super temporary filling for a baby tooth with a hole in it. I still think it is a good filling in some ways. But the problem is the dissolving of the clove oil into your saliva and then it numbing your whole mouth and affecting the skin of your mouth. That's one of the downsides of the use of clove oil because of the eugenol in the clove oil. Now, if we had a dead or dying adult's tooth, as a dentist, again, we would put a cotton ball soaked in clove oil into the cavity and expect that it was going to kill the nerve of the tooth fairly gently with a numbing effect, which was perfect for the patient because you would put this in there, the toothache would go away, the tooth would die, and then you could get to work doing a root canal or whatever you're going to do to that tooth to solve the ultimate problem. We would put it in with the exact purpose of killing the tooth. That is what eugenol does. And if you place eugenol either in too much concentration or you place it on a tooth that is too close to the pulp or actually on any tooth, what happens is the eugenol in the clove oil will diffuse. It moves along through the tooth, traveling along the dentinal tubules. These are the little holes in the dentin. And in those little holes are the cells, are the odontoblast cells. These are the tooth cells. And they're very irritated by the eugenol and they will die. And if the diffusion continues, which it usually does, right through to the center of the tooth, you will kill the tooth. You will kill the center part of the tooth. Now, if you apply clove oil without thinking to your tooth, you may not know, or that tooth may still survive, feeling better because the tooth has been numbed by the clove oil, but it will in 5-7 years end up as a dead tooth. And you may have no idea why it died, and you will probably have forgotten that you put this clove oil over your tooth. So I absolutely do not recommend using clove oil unless you are fully aware that you have a dead tooth. And I'm going to describe different kinds of toothache and what they mean and how you can know if the toothache you're experiencing is from a dead tooth, definitely dead tooth, or if you shouldn't be using clove oil. And I will explain how you can tell from the different symptoms. You see, toothache or tooth pain is simply a symptom that something is wrong. And it is not one thing that is wrong. We have a laundry list of things that go wrong in the mouth. And putting clove oil onto these things where you don't have to, most of the time, these are simple things that xylitol and my complete mouth care system can get better in a week to a couple of months and completely reverse the problems. If you use clove oil, most of the time, my belief is you are sending yourself into an arena where you're going to end up with more aggressive, potentially unnecessary, much more expensive and difficult treatments. So I am not an advocate for clove oil except in the emergency situations when you have a dead tooth. And I will explain how you know that. But when it comes to concentrations, again, let's talk about that now with eugenol, just so you understand that if you read online that you should put a cotton ball soaked in clove oil against a tooth, that is completely, totally ridiculous. Do not do it. The concentration of eugenol that is recommended, and it does have these amazing antioxidant, all kinds of great attributes at a concentration of 1 millimole per liter. And what might be a millimole? A millimole is 1,000th of a mole. And what is a mole? Well, a mole is something to the 0.000th. It's very small. And what is a liter? A liter is a quarter of a gallon. So let's look at this mole thing. How much? Let's take a little pinch of salt. A pinch of salt is 17 millimoles. At 4 millimoles of eugenol per quarter gallon, you will kill cells. You will cause cell toxicity. So a quarter of a pinch of salt in a quarter gallon of liquid could potentially damage your skin cells. The recommended dosage that we're talking about for any kind of benefit is 1 millimole per liter. And we can't titrate that. We can't mix that up at home. So please don't take your neighbor's homemade toothpaste that has clove oil and other things in it and assume that is good for your teeth. I would never use it. And I recommend that you don't. And I recommend that so many of these home recipes are misunderstood. Yes, they were used in ancient times. They didn't have many other options. If you have an option of getting hold of xylitol, that is what I would recommend, except in very specific circumstances where you know that you have a dead tooth and you are in great pain and that is waking you up at night. That pain may respond to clove oil. And then you go and seek treatment from your dentist as soon as you possibly can. So it's in extreme situations that it has a use, except in the hands of a dentist who knows what they're doing and will seal it into your tooth so that it doesn't travel everywhere in your mouth. I hope that that has explained the difficulty of clove oil, because there are some things about it that are excellent and wonderful, but there is a side of using it where if you're careless or you use the wrong concentration, you could do immense damage to your mouth and to your tooth and certainly to children's teeth. So please be very careful and treat clove oil with great respect. I'd say better to have a couple of cloves in your apple pie.